Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Hey, I'm great, thanks. Thanks for having me.
Absolutely. I'm excited for us to chat. I think we should dive right into it. I'd love if you could tell the audience a little bit about your background, and then we'll go into today's topic.
Great, sure. So I am the Chief Operating Officer at Buoy Health. I've been with Buoy for 2 years, and prior to Buoy, I was at another healthcare tech company, Patient Pop, based in California. And before that, I spent about 6 years at Athena Health. I have a public health background and have always worked in digital health and healthcare technology.
Patient Pop. I thought I ran into someone at a conference at HIMSS. Was Patient Pop in like cancer research?
No. Patient Pop is actually a patient acquisition platform. So it's basically a marketing platform for small physicians' offices. But maybe something similar. A lot of people confuse it with patient ping. So
yeah, it was just something with Pop. They were doing, basically looking at someone's like genetic makeup in order to diagnose them with cancer and like different types of how they would treat it.
Oh, interesting.
You'd like send them in. It was like, I think part of the tumor or something. And like they would work on, it was something really crazy. And this was when I first started out in healthcare, and I ran into someone, I'm like, oh yeah. Not knowing I went home and looked it up after, but okay.
Yeah. No, lots of good stuff going on. That's funny though.
Okay. So you left there, you came to Buoy Health. Yes. Buoy obviously has had an incredible last year. I remember I heard about you a little before that, but pandemic hit, and then I was hearing about you everywhere and your efforts and how you were helping with COVID. And then we had Dr. Lay on the podcast, and he was able to tell us about some of that, gave us a background of what Buoy is. I'd love to hear what your role exactly is at Buoy and kind of what you do. And then we'll go into some of, I know you wanted to talk about some DEIA initiatives that Buoy is really sticking to. So I'd love to hear more about your role first.
Yeah, sure. So I joined Buoy a couple of years ago, and as COO, really overseeing all of our execution functions. So our administrative functions, finance people, legal teams, and then our R&D teams as well. I now also oversee our customer success and implementation teams. So really involved across the board, very much a cross-functional role. And which was what led me to really oversee and take on our diversity, equity, and inclusion efforts.
Yeah, so you're involved with a little bit of everything, and probably not enough time. Am I right?
Yeah. I think that's a good way to put it. Yeah. COO roles, as I've learned, are really always different. And at Buoy, it's really about being the connector across the business and across all of these different departments and functions. But really, I lean on the incredible leaders that we've brought on and developed in each of those functions, and really just sort of help them remove blockers and connect them with the rest of the business.
Perfect.
Mm-hmm.
Well, I think we should shift focus now to the focus today, which is diversity, equity, inclusivity, and accessibility, right? Because we went through this for the audience. They have an extra thing that you focus on, accessibility, with kind of the acronym. So I'd love if you could tell us more about some of these initiatives, and then what led you, I guess, in particular, to kind of want to be the champion for these efforts at Buoy.
Yeah, great, thanks. So, for us, DEIA, so we call it diversity, equity, inclusion, and accessibility. So as you said, we add accessibility because we are a healthcare tech company. We make our technology available to the public, to all consumers on our site, buoy.com. And so our goal is to be the best way to get better for everyone. And if we didn't include accessibility and the inclusivity of our products in our company-wide efforts, then there's no way we could do that. There's no way we could be the best way to get better for everyone. So it's really important to us that we include product, all of R&D, design, the design teams, the user research teams in our DEIA efforts. And we is part of the reason that I oversee this effort, because it really is very, very cross-functional. I think a lot of companies see DE&I as a people team effort or as a C-suite effort, but for us, it's everyone's responsibility. Our DEIA team includes representatives from, as I mentioned, product design, R&D, our legal team, our people team, our medical team, our marketing team, and our business development team. So across the board, everyone is involved, which is part of the reason it was sort of the COO or the operational responsibility for the company.
Yeah, wow. We throw it into your bag of everything else you have to do as well. Wow. How does it tie to your business objectives?
Well, it's funny because we never really thought about that. It's, for us, it's just basics. Like, it's something that we knew we needed to do as a company. It wasn't about whether this was good business or not, or it made financial sense, or there was some sort of business case tied to it. It was simply that, it's the right thing to do for our employees, for our product, for the industry. This is, I think if you tried to make a business case for it, you might say, well, Buoy's a pretty small company. They're not profitable, venture backed. Maybe it doesn't make sense for us to invest a whole lot of time and energy into this effort, but that really wasn't ever a consideration for us. We believe that our products need to be accessible and inclusive, and that our company needs to be inclusive, diverse, and equitable, and that everybody deserves to work in a workplace that operates that way.
How would you say yourself and the rest of the team kind of hold everyone accountable to stay on top of these initiatives?
Yeah, well, first, a little bit kind of about our initiatives. So we first really knew we needed to understand where we were as a company when we started this effort. So we did a lot of baselining. We looked across our company, did a demographic survey, published our first DEIA report that sort of outlined where we were as a business across all of these different efforts and measurements. So how diverse is our company? Are the people here? How inclusive are we as a business? How included does everybody who works at Buoy feel in the efforts? And then how inclusive and accessible are our products? And so we sort of published this report that provided this baseline, to everybody in our company and also externally. And then that allows us, a starting point from which we can measure ourselves. So we use, in terms of holding ourselves accountable, we use a lot of company-wide surveys, a lot of cross-functional forums, employee chats. We discuss what we're doing externally, like we're doing today, but also on our blog, which allows other people to hold us accountable, and it forces us to hold ourselves accountable as well. So I think it's very much about kind of sharing what we do, and pushing ourselves to continue to do better. I'll also say that this effort is sort of it's a self-fulfilling prophecy. Once we stated that this was really important to us, and we put ourselves out there talking about it, we ended up attracting people to our company. When we were hiring, we ended up hiring about 35 people during the pandemic, but hiring people that really care about this too, and bringing people on that are going to hold us accountable, hold their executives accountable to all of these efforts. So, I think there are a variety of factors, but it's really just about making this a company-wide initiative, stating externally and internally that this is important, making it one of our 7 company-wide objectives for the year, and then keeping that up quarterly, and then going from there. So a variety of ways, but we've been able to stick to it so far.
Now you're all still completely remote. Is that right?
We are. So we have a few people who go into the office every now and then. They use our own product, our back to work product, but for the most part, we're completely remote. And we established a work from wherever policy for the company post-pandemic as well. So people can live where they want to live, work where they want to work. And I would say that also contributes to our internal diversity, equity, and inclusion efforts being able to hire people across the country, regardless of their location, allows us to really create a more diverse workplace. We were pretty bi-coastal before, a lot of people from New England and a lot of people from California. And I'm really excited to say that we have much more representation across the country now. Also, people are able to live in more affordable places than Boston and New York City. So again, really allowing us to increase our socioeconomic diversity as well.
Yeah, if there's one thing I would say, which there's not many things, but one thing good that actually came out of the pandemic was it seems like we realized that more people can work from anywhere. And I mean, it really depends on the person. If someone's not getting their work done and stuff, then maybe they're just not meant. Maybe they weren't going to be good in the office either, because
right.
Everyone I've talked to that has this opportunity to work from anywhere has really loved it, and they do miss the face-to-face. So I think the next challenge is going to be how do like little summits and retreats come together at certain times with everyone, which obviously that'll present another challenge, right, with scheduling and flights and everything. But the fact that I still think that stuff needs to happen. It doesn't need to happen frequently, but at least once or twice a year, I would say there needs to be some sort of face-to-face, or at least give everyone the opportunity to have the face-to-face. Whether they take it, that's their choice.
Oh yeah, we're absolutely in the throes of figuring that out right now, putting together our work from wherever plan. So we decided, luckily we decided early that we were going to do this. We decided back in July that we were going to move to a work from wherever policy. Even post-pandemic, nobody knew what the timeline was at that point, but we stated that's what we would do. So that really allowed people to pick their heads up, think about where they wanted to live, how they wanted to work, and be where they wanted to be. So, it's also, I think, this remote work has really forced everybody to accept this sort of like bring yourself whole self to work mentality. It was something we talked about a lot at Athena Health. It's something I've always felt like, be who you are and bring your whole self to work. And remote work has really forced that. We've got kids sitting in, little kids sitting in laps during Zoom meetings. We've got, there's a lack of childcare. We've got people, all over the place traveling, working, in their parents' homes or with their family around. So I think it's really forced that, which has been great. And I also think, now we're figuring out, yes, how do we bring people together in a responsible way, in a way that makes everybody feel comfortable. But we're thinking, quarterly company-wide retreats once travel is acceptable again and more widespread. So, and then a variety of other sort of social events. It will be much more deliberate in terms of how we bring people together and the why behind it, as opposed to just expecting people to be butts at desks every day.
Well, I'm excited to continue the conversation with you and Buoy Health. And I know we want to do some other episodes together on some topics. So maybe you'll be on another one of those and we can either circle back to this topic, see how things are going with it, or we can talk about something else. And I don't think we'll ever run out of something to talk about based on the different hats that you wear. So I'm excited to stay in touch with you. And I thank you so much for joining me on the podcast.
Great. Me too. Thanks so much, Jared. I look forward to touching base about this again.